Good afternoon, everybody, and welcome. This is our latest update. And as from next week, we're going to change the format, only in the sense that we will have our briefings on Wednesday and Friday, same time, same place. We'll still be here and we'll be making our comments. Now, with the 19th, 3 days' time, we'll be opening up phase one if all goes well. And as we sit here today at lunchtime on the Friday, all is going well. So it's very likely indeed that on Monday we'll be into stage one. There are three members on the panel with me today. Dr. Brink will, as usual, and with the usual efficiency, go through where we've been in cases in the last couple of days and any other matters that she feels is material or are material to draw to your attention. Then our Chief Executive, Paul Whitfield, will deal with a variety of matters, including questions that have been asked in relation to business, guidelines, and other matters. But I do emphasise in relation to that, it is the responsibility of each business to make a decision as to whether they comply with the guidelines and stage one. It is their responsibility, albeit Mr. Whitfield will do his best to help you. And then we have Head of Law Enforcement, Rory Hardy. The police and border agency have had a very difficult job. They've always got a difficult job, but in this particular pandemic, they've got even more duties imposed upon them. And Mr. Hardy will take us through areas of concern and other matters that he feels in his professional experience need to be mentioned. Let me just say this in connection with where we are. When we started off with this current outbreak, which came to light on the 22nd of January, we were very much on the back foot. I don't mean that we weren't prepared in the sense of look at the testing and contact procedures that we've gone through, look at all the other things that have been done in the last 4 weeks, but we didn't expect to have this contest. Now, if I can use a boxing metaphor or analogy, we're like a boxer who was not expecting to have this contest at the moment. We're ahead on points at the moment, but if we drop our guard, we could have something like the famous Henry Cooper left hook, which left the great Muhammad Ali on his backside all those years ago. So we have got to make sure that we remain ever vigilant. And stage one is just dipping our toe in the water. It's not meant to be opening up of businesses to the extent that they were pre the 23rd of January. We understand that businesses have been pressing and saying, can we just do that? Can we just do the other? And the answer is, if you do not fall within stage one, you cannot and you will not. We're trying to endeavour to open up businesses as we can and as quickly as we can. But what you'll be able to do from Monday is limited. And if you feel that you cannot operate your businesses within those parameters, then we're sorry for that, because we want business to prosper and to do well and to people to get back to work in normality. But then you won't be able to open your businesses. One of the things that Mr. Whitfield will also speak about are schools, because naturally and absolutely rightly so, people want to know, when can my children go back to school? I've got arrangements to make. I want to get back to work. And it's difficult for parents having to try and work and have children at home and educate them. So Mr. Whitfield will deal with that. But the truth of the matter is that it's very, very likely indeed that in stage one, the schools will remain where they are. But we are in regular contact. Mr. Whitfield and his officers are in regular contact with education, sport and culture. Now, as I say, we've got Head of Law Enforcement and he'll deal with that. Most of our community, as you would expect, are following the rules. There will always be some that won't. And if they do not, then they will be have the law enforced upon them by our very many able police and border agency officers. And let me just say something in relation to that too. I saw a very, spiteful, I would say, it's my word and nobody else's, comment in one of the media this week about, there's too much praise. Effectively, this was being said for public sector workers, they're being overlauded. No, they are not. The officers, the police officers and the border agency officers, the teachers, the healthcare workers, the medical professionals, the care assistants, some of those, of course, in the private sector, they are at the very vanguard, as are other people. They are there doing their jobs, and they're doing their jobs well. So they deserve every iota of praise they get. And if others don't like it, well, I'm afraid they will not have to like it. I make no apology for repeating my absolute admiration for the work of all the people that I've mentioned. Now, we've also got this one thing I'd like to comment on as well. We've had some comment about face coverings. Compliance was good before they became mandatory last Saturday, but it was not perfect. And given that we've seen cases of COVID arising in supermarkets, because even if it's a big supermarket, you're still in a confined space, we wanted there to be no doubt at all that when people, because we have to go into shops by and large to get our food products, some are delivered, but most people still go to the supermarket, then we want everybody to be protected. But it's the police officers that are going to police this, not the staff in the supermarkets. They don't have to expect to do that job. There's no responsibility upon them at all. And there's no responsibility upon you as a good citizen to deal with that. Some people cannot wear masks and face coverings for very good reason. So there are some will be fitting or will have sunflower lanyards, and there'll also be downloadable images. So, but even then, if you see somebody not wearing a face mask in, for example, a supermarket, that's not for you. That's for the police officers to enforce, and we need to be satisfied, as I am entirely, that they will do their job properly. Now, we're all going through a difficult time, some of you much, much, much more than me, and that's appreciated. The weather's been poor. When we had the first outbreak last time, we had the good weather. That was about the only thing that could be said for it, but we did have the good weather. We don't have that this time. And the days have been long, etc. The days have been short, albeit short in daylight, but long in the way that people have had to pass their time. We're sorry about that, but we can only proceed from phase 1 to stage 2, and then stage 2 or phase 2 to stage 3 if everybody keeps complying with the rules. I'm sure you will. I'm sure that you'll accept that that's the best way forward, because if not, and this is the last thing we want to do, but if we have to move backwards because there's some break in the good news and there's some concern to us, we will do so. That's, as I say, and I emphasise, the last thing that we want to do. And that's the last thing you're going to hear from me at the moment. It's Dr. Brink.
Thank you very much. And I'm going to go through my slides now. So if we start off with slide 1, that, of course, gives you the summary of where we are at the moment. So from the 22nd of January, we've had a total of 500 cases, and I'm pleased to report that the majority, now around about 80%, have recovered. So out of the 412 cases that we say are closed, 411 have recovered, and of course, sadly, we've had the one death. We now have a total of 88 active cases. In fact, we've just recovered another 3 people, so we're down to 85 as of 12 noon today. And that means that less than 20% of our cases are now active. So we've had a really good response. So the lockdown has worked. The compliance of the community working together is really getting us into a favourable position. So very, very optimistic. Now, as always, I like to try and look at the evidence now and sense check the data that I'm looking at. So with regard to our hospital admissions, we currently have 2 people in hospital. So that's again down from yesterday. So that's another encouraging sign. Speaking to my colleagues in the emergency department, they're seeing fewer people presenting with respiratory symptoms, exactly the same for primary care. So all of the parameters we've got show that we are moving in the right direction. They are positive. And so we are very, very pleased about that. So if we then go on to the next slide, and that shows you the COVID summary over time. So the maroon slide tells us the total cases together, really important, and you can see that flattening off. And you can see the green, which is the active cases coming down, and the grey, which is the recovered cases going up. So that's exactly the trend we want to see, again, moving in exactly the right direction. So if we go to the next slide, which is slide 3, and that then gives you more detailed information. Here I need to sound a note of caution while we're going in the right direction, but we need to remain vigilant, as Deputy Fairbrash said. So if you look at the last 3 days, you can see on Tuesday the 16th, we had 1 unknown community source. On Wednesday the 17th, 2 positives, and they were both contacts. And yesterday, we had one contact and one case through planned workforce screening. Now, just for avoidance of doubt, when we get a case through planned workforce screening, we're going out to look for that case, but it's still a case occurring in the community. So it is still a case that we need to focus on really carefully. And I think that's important, that what we're trying to differentiate is between those people that are ill, that are coming forward seeking healthcare, to those that we're actively hunting out. Now, finding those cases in the community is really beneficial, because what we can then do is we can contact trace immediately around that case and prevent onward transmission. Now, some of those cases will be asymptomatic cases. We know that we will see asymptomatic COVID-19, but some of those, importantly, will be pre-symptomatic. So there'll be people that have come up positive before they've actually developed symptoms. Now, that's really important to try and isolate those people so we can prevent transmission from them. So it's really important that we identify those cases and positive moves forward, but we need to keep our guard up because we are still seeing the odd community case. So if I go to the next slide, which is slide 4, and that basically shows the case attribution over time. And that, again, is going in exactly the direction we want. So you can see the total flattening of the curve. We're squashing the curve again, and it's coming right down. So really positive and really encouraging steps forward. So if we go to the next slide, which is slide 5, and this is our vaccine update. And again, we're very pleased with the progress of the vaccination program. We've delivered, as of the 14th of February, 19,284 doses of vaccine. We always report the vaccination data in arrears because we're vaccinating at different areas. So, for example, we're using our community vaccination centre, but we're also delivering some vaccinations through primary care and also on a more bespoke basis to various groups of individuals. So we pull that data together on a weekly basis. And of those 19,284 doses of vaccine, 13,950 of those were first doses. Now, we also report on the doses per 100 people in the population. And the reason why we report on that, not so much as we feel that this is a vital indicator for us, but it is what is being reported around the world and in other jurisdictions. So it enables you in the media, but more the whole of the population of Guernsey, to then compare where we are compared to other jurisdictions. So our dose per 100 population is at 29.5 as of the 14th of February. So we're very pleased with the progress. We are very pleased with the engagement of everyone in the vaccination centre. We've had positive feedback, but as ever, if there are areas we can improve on, please do let us know. So if we go to the next slide, which is entitled slide 6. Now, we've had quite a lot of questions about long COVID. And long COVID is a term that is not really being used medically now because we're trying to differentiate COVID into 3 groups. So the first is an acute COVID infection. And in fact, the symptoms of an acute COVID infection can last for up to 4 weeks. Weeks, and that's now been termed as ongoing symptomatic COVID. So people still have symptoms, and there's but up to 12 weeks. And then from 12 weeks onwards, we have an entity what's called post-COVID syndrome. So post-COVID syndromes is when you have signs or symptoms that are present after 12 weeks of having an acute COVID infection. Now, it's important that we try and work out what's going on post-COVID so we can design the right treatment programs and provide the right support. And we're looking at that in more detail at the moment. So what we will be doing in the next 3 months is we're going to be sending out surveys to everyone who had COVID to enable us to get an idea of how many people still have symptoms post having an acute COVID infection. So if we go to the next slide, which is entitled slide 7, that gives you some more details on what long COVID, what post-COVID syndrome is. And what is important is the likelihood of developing post-COVID is not related to the severity of symptoms. So it's not related to whether someone's been hospitalized or been really unwell. It just happens. And we think about 1 in 5 people will have some sort of symptoms. What we're not sure is how long those will go on for. Now, if you look at the studies done, the most common symptoms that people are complaining of are things like breathlessness and fatigue. But quite a few people will describe what they call as brain fog, and several people have described this to me, where they just find it difficult to concentrate. Sometimes they find that their memory wasn't what it was before. So those type of symptoms. Now, the symptoms also can be just one symptom, there can be multiple symptoms, they can be fluctuate, they can be transient, they can be constant. And so there's a huge variation in the clinical presentation. And I think one of the things I always say when people talk to me and say they've got post-COVID syndrome, I always want to make sure that there isn't another medical explanation for their clinical symptoms. So I think it's really important that if you do have those symptoms, you do discuss them and make sure that there isn't another underlying cause that could explain those symptoms. So we are looking at an approach in Guernsey and how we can manage post-COVID. And I say one of the things we are going to do, but we need to wait about 3 months post this wave. So around about June time, we will be looking at sending out a survey to people who've had COVID to ascertain how many have residual symptoms. But in the meantime, what we're suggesting, if people do have symptoms, is to go and see their GP. Their GP would discuss it with them, possibly do a chest x-ray, possibly do some blood tests, but they'll do a full assessment. And indeed, if they have certain symptoms that they think require specialist care, the GP may then refer them on to specialist services. Now, Dr. Raby and his team are looking at developing more services surrounding post-COVID syndrome, but that's still being considered at the moment. But in the meantime, see your GP, make sure there's no underlying cause, and if your GP is concerned, they'll then refer you on to specialist services as appropriate. So my final slide is entitled Release Triggers, slide 8. And I think what's really important is that we are in an optimistic position. We're moving forward well. We've had a really, really strong outbreak of a variant virus, and we've controlled it really well. We can't be complacent. We still do have those odd cases in the community, and as we ease, we may well see cases in small clusters pop up. That's why we've got our track and trace program. But if you look at the triggers for release, so the triggers for release are new clusters of infections or individual cases that cannot be controlled by the test, track and isolate. We've got no evidence that such cases are now occurring in our community. If you'd asked me that question 2 weeks ago, the answer would have been entirely different, but we have fulfilled that. Adequate hospital, community, emergency and primary care capacity, again, all of our colleagues working in those sectors have confirmed that they've got adequate capacity. We've got our local testing program. We're regularly testing 1,000 or more cases a day, so that's important. Our surveillance program, so that's part of our planned workforce screening and other surge testing that we're doing, is working really well. The rollout of our vaccination program is on target. We're vaccinating as many people as we can. And of course, key to this is the incredible support that we've had. So unless something occurs over the weekend, from our point of view, from a public health point of view, we're good to go to stage 1 on Monday. So thank you very much, Deputy Fairbush.
Thank you, Dr. Brink. I'm going to go straight to our Chief Executive now, Paul Whitfield.
Thank you, Deputy Fairbush. The rollout of the online form for businesses in place, so if able to do so, businesses can notify the states of their intention to operate within the rules of stage 1 has gone well. We've so far had more than 600 businesses complete the notification form. Businesses can find the form on our COVID website along with all the guidance for the requirements for operating during stage 1. I would strongly urge all businesses to review all the information there, as it is clear and it sets out the rules and principles businesses must comply with if they are intending to operate. Understandably, we've had businesses contact us with questions and suggestions how they could change their operations in order to do so, as they see it, to comply with the requirements. This kind of imaginative approach is to be expected from commercial operations, understandably keen to resume trading in a meaningful way. But I would again come back to a message several members of our panel have stated previously. Please adhere to both the specific principles in place for stage 1, but also the spirit of what we're trying to achieve here. The key strongly remains to limiting the amount of contact between people. We are still in lockdown, and in lockdown for a reason. Stage 1 only gently takes the foot off the pedal. We need to see, with a small and limited increase of activity, if there is an adverse reaction and increase to COVID cases. We have to take a steady and cautious approach as we gradually open up the economy. We do well in stage 1, we get to stage 2 far more quickly. Understandably, some businesses are frustrated and raring to get operating. However, during this hopefully short transmission in stage 1, only open your business if you can safely operate in a non-public facing way, which means no in-person customer contact at all, with no more than 10 staff working if outside, and no more than 5 if working inside, and in all cases socially distanced. Again, there are further requirements that also need to be met, and all those and extensive guidance is on the website, so businesses really do need to read that information. One specific element of business operations that have come up a fair amount in the last couple of days is that of collections and deliveries. I just thought it might be useful to clarify the position on collections. The key part here is no customer contact. So if you can operate in a way where you take orders over the phone or online along with payment, then you can leave the product outside for a customer to collect, and you meet all the requirements I've already mentioned that are on the website, then you can do collections. But there must be no customer contact, and that includes customers having contact with each other while picking up collections. That is the business's responsibility too. There is no point setting it up so customers can collect with no direct contact with your staff, only for you to have arranged collections in a manner where lots of customers are turning up at the same time. The no contact rule with customers applies similarly with deliveries. If you can drop and go without customer contact, it is permitted. Turning again to a brief update on education, we already clarified that stage 1 means no change for our schools and preschools, which will continue to be open for vulnerable students by invitation for the children of essential workers, where both parents are classed as essential workers, or a lone parent in a single adult household where that single parent is engaged in essential work, which must be completed away from the home. Discussions between public health and education teams have continued as they work up plans to best open schools and settings to all our students in a coordinated and safe manner within stage 2 of the exit framework. This will be a phased return to school, with the ambition at this stage being for all pupils to return over a 1 or 2 week period following the island's move to stage 2. There will be other measures in place, many of which students will be familiar with from when they returned to school following our first lockdown. These will include class or year group bubbles and staggered start and finish times and breaks. A document outlining the education pathway as we exit lockdown will be published by the Committee for Education, Sports and Culture very shortly. Lastly from me today, I just wanted to address what stage 1 means for recycling facilities, as this again is an area where we've had a number of questions. Curbside collections of household waste and recycling and collections of waste and recycling from essential businesses have continued throughout lockdown and will continue to do so. When stage 1 comes into effect on Monday, hopefully, Guernsey Waste will open the household waste recycling centre at Longhoog and the green waste site at Shuey. These sites will be opened under strict distancing and PPE requirements, and the number of people allowed onto the site will be regulated by the staff, so there may be longer delays getting through the facilities than you would normally experience. Commercial waste sites at Longhoog and Montcuet will also be open from Monday for commercial customers. But I would remind us all that Bring Banks will remain closed until stage 2. Please keep an eye on social media, where Guernsey Waste will update with latest information regularly. Thank you, and back to Deputy Furtbrush.
Thank you very much, Paul. his first appearance, I think, on this cycle. But we're now going to pass over to our able Head of Law Enforcement, Rory Hardy. Rory.
Thank you, Deputy Fairbrush. A very good afternoon, everybody. I would like to take this opportunity and start by thanking the communities of the bailiwick for their acceptance and their compliance with the emergency regulations. Law enforcement have faced a number of challenging situations in the context of what I would describe as business as usual since the 23rd of January, but fortunately they are limited to a relatively small number of incidents. Frontline COVID-related enforcement work is ongoing by staff from the Guernsey Border Agency, who continue to monitor travel-related self-isolation. This work not only seeks to ensure compliance with the requirements, but also ensures that those undertaking isolation have contact, support and access to advice. There are currently 186 people in travel-related self-isolation. There have been 34 investigations into breaches or alleged breaches, and we have achieved 15 convictions. There are currently 5 ongoing investigations. We're also dealing with investigations connected to breaches of the current lockdown rules. Where possible, we seek to engage with the community and we seek to ensure that the requirements are fully understood and encourage everyone to follow the rules. However, if necessary, we will take enforcement action. During this second lockdown, law enforcement have received nearly 300 calls in respect to lockdown issues. As a result of these calls, 63 people have been given words of advice, 17 people have had final warnings, and 3 have been reported for COVID-related offences. Since the compulsory wearing of masks came into the regulations, law enforcement have only received 5 calls in relation to the wearing of masks. No fixed penalties have been issued, and no people have been reported. Again, can I thank our community for their compliance?
Absolutely.
As the statistics show, there are very high levels of compliance across the community. We all need to be patient and considerate of others. And I'd like to take this opportunity, as Deputy Fairbrush said in his opening, that we are here, law enforcement, to help on these issues. And if you have any concerns or issues or things you'd like to raise, please do not hesitate to contact us. We are there to help. We've also highlighted that during lockdown, attempts of scammers have not halted and people still try and target people in our community. As we become aware of new scams being circulated, we will publish these on our website and also through media channels. If you feel that you've been victim of a scam, please, in the first instance, contact your bank, or alternatively, go to the law enforcement website where there's information as to where you can seek help safely. Whilst in the main, the community comes together at times like this, there is always a small element with criminal intent who will seek to take advantage, and we must all remain vigilant. We do understand that some within our community coping with lockdown, it's not easy, and we know that in some cases it prevents difficult situations. Sadly, we have seen a slight increase in calls for service in relation to domestic incidents. In terms of domestic abuse, we're dealing with a number of cases each day, but we, law enforcement, are here to help and keep everybody safe. No one should be living in fear or under the threat of abuse. There are people you can contact, and we've highlighted again these contacts on our Facebook page and website. Otherwise, if you feel you're at immediate risk, please call 999, or if you wish to seek other advice, call the normal police line on 725 111. We also know that lockdown is having an impact in some of our community in terms of well-being and mental health. During lockdown 2, we've dealt with 43 incidents linked to acute mental health and self-harm. Again, please, law enforcement are here to help. Don't suffer in silence. If you need to call us and seek advice, we'll do our best to refer you to the most appropriate agency. The Joint Emergency Services Control Centre continued to manage the blue light services and Coast Guard across the bailiwick, as well as providing the clinical triage for the COVID-19 medical helpline. Since the second wave of lockdown on the 23rd of January this year, the clinical helpline has managed nearly 5,400 calls concerning symptomatic callers and referred nearly 5,500 people for COVID testing. Since the 6th of March 2020, that team has managed 26,500 calls for clinical triage. It's quite an achievement, and well done to that team. The Essential Worker Programme for proactive screening has proved really successful for law enforcement, and we're very grateful to the support we've had from public health. This has enabled us to protect the public and also provide our broader workforce with confidence and to put in place early intervention where necessary. Briefly, I'd like to thank all the staff across law enforcement for their efforts throughout this difficult time. Finally, just to reiterate, there have been some terrific community compliance with the emergency powers. We will be continuing the community policing style of engagement, explaining and encouraging. However, we will be using enforcement as and when necessary. Thank you all for your support.
Thank you very much, Mr. Hardy. Thank you indeed. Members of the media, it's now your opportunity to ask the panel questions. Yes, Will Green.
Yep, good afternoon. This is Will Green, the business editor at the Guernsey Press. On the state's website, it says the following in relation to business support measures. In the event that the bailiwick is still subject to significant restrictions by Monday, the 1st of March, the co-funding payroll scheme will be enhanced to cover 100% of the payroll for businesses that remain heavily impacted. Given that the 1st of March is little more than a week away, and to provide certainty and reassurance to companies and workers, will this action be triggered?
Let me deal with that, because politically it's a matter for policy and resources, of which I'm the president. And the answer is the intent is it will. We regularly meet. We tend to meet on a Tuesday. We will be discussing it again on Tuesday, because obviously that is the last time before the 1st of March, or the last scheduled meeting before the 1st of March. But the likelihood is that the answer to your question, Will, is yes. Hamish, your question.
Yes, Hamish Alscary from ITV Channel. A question to Rory, just to follow up on what he ended with, the talk about the number of cases each day to do with domestic violence incidents and the number of incidents to do with acute mental well-being and self-harm. I wondered if you could make an assessment on how that compares to the lockdown last year, for example, please.
It's very similar figures. Obviously, we are quite able to cope with the volume of demand, but it's very similar to the early stages of the previous lockdown.
Thank you. Matthew Leach.
Hello, Matthew Leach here from the Bailiwick Express. A question for the CCA. Has the CCA investigated the use of the Oxford-created COVID tool for fast-tracking vaccinations? I know this is something the Jersey government is looking into and is currently being used in the UK.
Dr. Brick, I think, really, for you.
The answer is the COVID tool has been used to look at the risk assessments and the prioritisation into priority groups 1 and 9. And so we are using those same priority groups which have been generated through the COVID tool. So absolutely, yes. The additional measures that they're looking at using COVID for additional prioritisation in relation to the clinically extremely vulnerable group. In reality, most of those groups as possible in priority group 6, but that also relates to guidance on shielding. So the data that we're using to prioritise vaccination is based on the COVID tool.
Thank you. Jim Delbridge, your question, Jim.
Thank you, panel. Just a quick question. Now that exercising hours is increasing from 2 to 4 hours, are there any plans to open up public toilets again when people are out having a run or whatever? Thank you.
I think I'll come to Paul, but I think the answer is no at the moment, because again, it's people getting in close proximity to each other as you can do in a toilet, particularly male toilets. Is that right, Paul?
Yeah, that's absolutely right, Jim. We realise that it is an inconvenience for people that want to use those facilities, particularly if they're taking a particularly long walk. But as Deputy Furbrush has said, it's not only the congregating of people in a small space, it's obviously the ability. Normally those facilities will be cleaned probably about twice a day and checked, but clearly at a time of the spread of a potential spread of virus, then they would have to be cleaned more or less continuously to be made safe. So it's certainly something that we will look at again towards the end of stage 2, going into stage 3. But at the moment, it wouldn't be safe to do so.
Thank you. Ewan Duncan.
Hi, Ewan Duncan from BBC Guernsey. Question for Dr. Brink. I'm aware that the prioritisation for the vaccine for those aged 50 or under is still to be determined. In the UK, the Education Secretary, Gavin Williamson, has said that the teachers are going to be a top priority in their next vaccination phase. Is it going to be the same here in Guernsey? Obviously, Jersey Teachers Association are asking for their teachers to be moved up the list. And I suppose other workers like the police, we would like to see at the top of the priority list.
So again, that's yet to be decided. We'll look at all the data that comes out. I think more information will come out from the UK in the next couple of weeks, and we'll look at what comes out from them. But ultimately, that's also a decision for the CCA.
Thank you. And just finishing on that, but we will make a decision based on the advice that we receive in connection with that. And as Dr. Brink said, that will be reviewed in the next couple of weeks. That doesn't mean there'll be a change. It's just that it'll be reviewed. Will Green, your next question, please, Will.
Yes, thank you again. A supplementary, really. How long is the modelling for business support to continue? Will it be until we enter phase 3 or beyond that, particularly for hospitality and tourism?
And again, without sort of not answering the question, it is under review. It'll certainly continue for stage 1, and it likely will be somewhat into stage 2. Now, that doesn't mean it'll end then. We'll be reviewing it. We'll be reviewing it on Tuesday. We'll be reviewing it regularly. Who should I ask next? Matthew Leach. Matthew.
I'd like to revisit a topic I asked about earlier in the week, where you mentioned you talked with Dr. Raby regarding antenatal scans being allowed to be recorded. Is there any update on any leniency here?
Yeah. Dr. Brink?
So I think what they're going to be doing is looking at partners being able to attend antenatal scans next week with the appropriate social distancing and precautions. So very much like pre-lockdown. So I think this is an area that I know has caused a lot of concern, and Dr. Raby and the team have looked at that in detail and will be looking at a change policy next week.
Thank you. Hamish Osprey. Hamish.
Yes, thank you. Dr. Brink, I wonder if you could give any more detail on in which sectors, for example, the routine workplace screening is finding cases. This is a question from a member of the public who's concerned that there are still unknown community cases and they don't know where these are being found.
It's not in one particular sector. It's across 3 different sectors that we've looked at. So we got a few cases in education, we got 1 case in health and social care, and then we got a further case in the bailiwick law enforcement. So, and this is not surprising. So we are finding these cases so that we can specifically contact trace around those and put in the appropriate prevention to prevent ongoing transmission. So it's not surprising that we found these cases, and it's part of our active surveillance program. But yes, they are still community cases, and that's why we need to stay vigilant.
Thank you. Jim, your next question, please.
Thank you, panel. Thank you, Dr. Brink, for all the latest vaccination figures. Interesting to see the amount of first vaccinations and second vaccinations. My question is why can't people who have been vaccinated go and visit their loved ones in a care home who have also been vaccinated? Could you explain that, please?
So the main aim of the vaccination program is to prevent COVID-associated morbidity and mortality. With the data on whether vaccination prevents transmission of a virus, there is hints that it does, it looks promising, but the data isn't there yet. So as we learn more about the vaccination program, we will, of course, be looking at reviewing policies. But most people in care home settings are vaccinated, but that doesn't mean 100% are. And so I think we need to continue to be vigilant, but I think this is an area that does need to be looked at, reviewed, and we will do that as more of our population become vaccinated. So this is something that we would be looking to to provide further evidence on, and we understand that it is a difficult time, but as the prevalence of the virus goes down in the community, as lockdown does that heavy lifting for us and gets rid of circulating virus, then we'll become increasingly optimistic that we will be able to reintroduce some of those measures.
Thank you. You and your next question.
So I just want to ask a question about ongoing monitoring of the virus in the community. Obviously, I'm sure that you're going to continue to test as much as you are now, but when cases are back to zero, community spread, are there things that we can do to monitor cases? I see there's an interesting study in New Zealand where they're actually monitoring the wastewater there to pick up coronavirus cases. I wonder, would it be something that we consider in Guernsey if finances allow?
Dr. Brink.
That's something we're already considering. So we're mapping out whether wastewater monitoring. So just for people who aren't familiar with this, is what you can do is look at various sewage outlets, and you won't get the whole virus, but what you can do is find the viral nucleic acid, and you can use that to map out areas in where you're seeing an increased level of detection of nucleic acid, and then you can go back and say what population that wastewater is serving, who's generating that wastewater, and then go back and then do some more detailed testing on that. So that's something we're looking at the moment as part of our ongoing surveillance program. It's been done in the UK as well, and Welsh Water are also doing it in some detail.
Thank you. Will, your next question, please.
Thank you again. I'm sure many parents would appreciate the update on the school and nursery subject. Realistically, what are the prospects of any phased reopening before mid-March? And when you look at the dates of the term time, actually, there isn't very much then before the Easter holidays. What's the reality? Is it going to be mid-March or after the Easter holidays, do you think?
Paul Whitfield.
Yeah, I think it's a good observation. You can sort of work back from the sort of indicative time frame we've given for stage one. We hope to be robust in stage one, and that gives us the success to get to stage two. And then we have to time that phase returning that I spoke about that 2 weeks. And I think what we'll do is correlate that with where that falls with the school holiday. Sometimes we've used that to our advantage as a good way to open the schools. So I know education are working very hard to closely monitor that, and it'll all go on when we feel it is safe to move and how close we are there then to the school holiday.
Thank you. Matthew Leach.
Question for the CCA. Could we have some insights into the long-term strategy to coping with COVID in the bailiwick, and what role will wider community vaccinations have on that? Are we potentially facing intermittent lockdowns until everyone is vaccinated?
No, is the answer. No, we're not. We would go back into lockdown if we had to, and if we were advised to by Dr. Brink and her team. Vaccinations are going to continue, not only beyond Group 9, Phase 9, they'll continue into the next stage. The intent is to vaccinate as many of the population as we can, and that'll take a time. Dr. Brink may want to just add something in relation to that, but the tactics going forward are to get us back to our normal activity as soon as we can. Opening up the borders depends not only on us but on other jurisdictions. But again, we certainly are not going to wait till everybody's vaccinated or go back every time we get a case. That will be a matter of judgment taken on advice. Dr. Brink. Sorry, you're muted, Dr. Brink. Yeah.
No, I think that absolutely sums it up, is that as our population is increasingly vaccinated, as we map the impact of variants, we'll be able to look at how ultimately we live with COVID.
Thank you. Hamish, your question?
This is a question from a member of the public. Should be fairly straightforward. They're asking if horse riding in groups of up to 5 will be allowed from stage 1. Assume within social distancing should be fine.
Yeah. Well, they're a group of 5. I mean, whether you go around with a metal detector or on a horse, it seems to me that's permitted. So the answer is yes. Who have I missed? Matthew. If I'm jumping from Matthew to Will, I apologise. Matthew, your next question, and I'll come to you next, Will.
Okay, I've got a question for Dr. Brink here about there seems to be a lot of conflicting news internationally about the vaccines and their effects on the South African variant. Could we have some insight into how effective our vaccines are against any mutations?
So SARS-CoV-2, the virus that causes COVID-19, is an RNA virus, so it will mutate. There is definitely diminished response to some of the vaccines, particularly the Oxford vaccine, to the South African variant. However, that doesn't mean there's no response. So my view is that vaccines will reduce the morbidity and mortality. They won't necessarily reduce transmission. What will happen as we move on out of the COVID pandemic is we will see some mutations in the virus, and I think we will see some variations of the vaccine every year, a bit like that what we see for the flu vaccine. But from my perspective, it is best to continue with the vaccination program, even if there is a slightly reduced efficacy to some of the variants, because you will still get some protection. And we've really seen this in this wave of infection. And to date, tragic as it is, we've had one death. That is very different to what we experienced in the first wave. And indeed, when we had cases in individuals in care homes and some staff members, we did not see what we saw in care homes in the first wave. So I think it is really positive as we move forward in the next few months.
Thank you. Will Green, your question.
Thank you again. Obviously, one of the more normal areas of economic activity is travel. Will the essential travel permit, which has obviously been a key safeguard, should we say, for the borders, will that continue into stage 3 or beyond that?
The answer is it will certainly continue through stage 3, and it's likely beyond that because we had it before we had the latest outbreak. It will continue beyond then. It'll be under constant review. We may have to tighten it. We may be able to relax it. It will depend on the circumstances as they develop. Hamish Osprey.
I guess it's kind of a follow-up to that question, actually. A couple of weeks ago, Deputy Fairbrush, you said that you were considering what potential measures could remain beyond the end of lockdown, for example, like mask wearing in shops, and you said you thought it entirely sensible that those things could remain. Have you made any decisions about what those measures may be?
No, not finally, because we'll look at it nearer that time, because circumstances, as I say, Hamish, can change. But just expressing my own opinion, because I'm just a member of the CCA, I think it's more likely than not that they will continue in some form or another well beyond the end of this current lockdown. Matthew Leach, and then I'll come back to Will again. Matthew.
Got a question from the public here about diving. We've been told that diving isn't allowed for stage 1 because the decompression chamber is out of action. However, shallower dives never reach decompression limits. Is this an activity that could be reviewed?
I don't know if Paul Whitfield wants to add anything, but I would have thought if we've already erred on the side of caution, because that's what we're doing here. We're dipping our toe into the water or into the sea, no pun intended. So we're making it very clear that we're being cautious, but we're trying to move things forward. I doubt that it will change. Paul, do you want to add anything?
No, I don't think it changes for stage 1, but we did deal with this in the first lockdown. And of course, as we increased with activities and permissible activities, people are windsurfing and doing that sort of thing, then we agreed for shallow water diving to take place. But we were very cognizant of the impact it could have if we had to deal with serious health cases. A tragic accident. So at the moment, we will be very cautious to do that in stage 1.
Thank you. Will Green. Will, you've got your hand up.
Yeah, thank you again. This is a question for Roy Hardy, if possible, please. Obviously, many people will be grateful for the border and law officers and police officers for all the work they've been doing. How many of your officers have been affected by COVID-19? Has that had any impact in terms of operations? And also, perhaps a question on the vaccine. Obviously, there is this debate about, if there's any spares left over at the end of the day. Could it be that police officers could get that?
First of all, like many businesses and other areas of public service, when we came into this phase from the 23rd of January, we did experience some pressure on resourcing. However, we have well-rehearsed contingency plans and a number of other areas which, although important, had to be reduced to support frontline operational law enforcement work were moved. So I can just reassure you that at no time will the public ever put at risk. There was always sufficient staff to deliver frontline uniform work. On the vaccine issue, I understand that there has been a lot of conversation around that. The bottom line is the people who are getting it first are most at risk of mortality or serious illness, and we fully understand that. And we shall wait patiently for an opportunity for our staff to receive the vaccine.
Thank you very much indeed. Dr. Brink, yes, you want to add something.
Can I also just stress that there is no spare vaccine, and I think that's really, really important. So what does happen is we can sometimes get an extra dose out of the vial of vaccine. We then have a list of people that can come in that are on the priority groups that are prepared to come in to get that vaccine. So there isn't any spare vaccine. We're using every last drop of vaccine that we can. And I think that's really important because we don't have loads of spare doses floating around. These doses are all being used up to their absolute maximum. Thank you.
Thank you, Dr. Brink. Ewan Duncan.
Yeah, just a question about the hospital. We're hearing from within the health sector that there's actually limited recovery space in hospital due to storage of equipment, because setting up theatres now during the lockdown is proving different because of obviously the COVID restrictions, and it does have an impact. We're being told on the surgeries that can be carried out because of the limited amount of space for patients. I mean, is this true? And what's being done about this to ensure that we can step up the amount of surgeries that we can do?
Well, I'll come to Dr. Brink, but I think that's probably more for Dr. Raby, who's not on the panel today, because the management of the hospital is a matter for him. My understanding from a few sessions back when Dr. Raby was on is that obviously elective surgery, etc., is limited for obvious reasons, but there is space in the hospital. I don't know if you could add anything, Dr. Brink.
So with various of the surgical procedures, yes, there are certain COVID precautions that need to be taken, which are both right and proper. And that, yes, does mean that some procedures and some changeovers will be longer than they normally are. However, everyone who is required or has urgent surgery, is requiring urgent surgery, that is being done according to the hospital policies. So, but as we move out, then those restrictions will, of course, be relaxed. But everything is focused on the safety of our patients, and that is our prime responsibility.
Thank you. Will Green.
There's a question from a reader, I think it may have been answered already, as to when mandatory face masks may be lifted. And also, there's been some research, some studies suggesting that the risk of outside transmission is relatively low.
Yeah, well, the answer to that is we've made no decision as to when they're going to be lifted. It's likely that they'll be with us for some time, and we've taken into account all the research that we've been advised about. And I mean, it's a point I just make in relation to delivery drivers. When I take my dog out, my dog Charlie out for a walk this morning, I said to him as we were walking, I saw 3 separate delivery drivers, none of whom had a mask on, none of them were wearing gloves. And I thought, how silly. And I said to him, he didn't comment, I said to him that in relation to that, those people don't know that when they go to put the parcel on the doorstep, just coincidentally, somebody may open their door and they're in face-to-face contact. It's not arranged, it's just one of those things. So whatever the research, the view that we take at the moment is that they should be worn in the circumstances where they're mandatory. And it's given me the opportunity, your question, which I'm grateful for, to ask delivery drivers to wear gloves and to wear face masks. Matthew Leach.
A final question from me. With both islands in a different position to last year, will the idea of a travel corridor with Jersey be revisited after this lockdown?
It will indeed, as it will with the Isle of Man. We'll keep that under review, and it would be lovely if we could have a travel bubble, if that's the right phrase, with Jersey and or the Isle of Man. Any other questions from anybody? I'm just looking, I can't see anybody. No, well, again, I'm grateful to the media for their questions. I'm particularly grateful to the panel. We're going to enter, fingers crossed, and I don't mean that we'll take any risk, that nothing dramatic happens over the weekend, and Dr. Brink doesn't foresee that, and we don't foresee that. And of course, I've already said previously, I've got my own first vaccination at 6:30 tomorrow. And I had an email from a good friend of mine who's 4 months older than me, and he's already had it, and he said it went very well. So I'm sure it'll go very well, and I look forward to it tomorrow. Thank you all very much, and we'll be back with you next Wednesday at 1 o'clock. Thank you.